Cancer is such an overwhelming diagnosis that there's so much information coming at you. And I think there's a lot of assumptions made that somehow you're qualified to understand what your doctor is talking about, when in truth you're not. I heard about Grand Rounds through my employer. Having the ability to tap into experts and the ability to find new practitioners and having access to that is an amazing benefit that my employer provides.
So I first spoke to Lynn after she started a case with us because she'd had an imaging scan done that potentially showed some abnormalities that were worrisome for spread of her breast cancer. She was concerned why her doctor hadn't really given her a clear next step. When she asked the doctor, when do I need the next scan done, she couldn't really answer that, and she wanted us to tell her what the scan showed and what definitively she should have done next.
I reached out to Grand Rounds, and they immediately engaged in getting all of my files and reaching out for an expert specifically that would look at the bone scan that I had. And they reached out to a Dr. Hentel, who is an expert in radiology.
Grand Rounds makes it easy to review cases, and the fact that it's been curated already, the ability to look at it online in an efficient manner with the imaging attached makes my job easier. After reviewing this patient's images and history, I recommended an MRI of the thoracic and lumbar spine. The diagnosis in this case was diffusely metastatic disease.
When cancer has spread, it's probably one of the most terrifying things you'll hear. In my case, it had come back and had spread throughout my skeleton, which means that it's really hard to treat and it's not curable.
When we learned that the cancer had spread to her bones and how extensively it had spread to her bones, I think Lynn was angry and I was sort of in shock. We were completely unprepared for it.
The first phone call that I actually got was from Alexis. She was there every step of the way through a process that is as scary as you can imagine. And it was almost not only like having a doctor in the family, but like having a friend there with you too.
It's not that we're done now. If she has additional questions as her treatment goes on, we can continue to help her along the way. I think it's really important for patients to understand what's going on with them. It's not just matching them with the best doctors at the right time. It's also empowering them to know more about what's going on with them at that time.
This opportunity to work with Grand Rounds and to essentially say, here, please help us, be an advocate for us, was a godsend. We could be still sitting here waiting for Lynn to have a second round of tests and not know at this point that she has metastatic breast cancer.
I'm just so incredibly grateful that Grand Rounds has been there through this entire process. The entire care team at Grand Rounds has been such a support system. They are on top of every detail. No stone is left unturned. They call for every appointment for you. And they are the friend and doctor that you need during the scariest time in your life. Getting a diagnosis like this makes you evaluate things and reprioritize so that you take a look at the time that you spend with family and friends and you appreciate every moment, and you make sure that you are doing things that have meaning, because if your time is cut short, you want to make sure that you're using it in the best way you possibly can.